Does your skin look like this? Or have you seen skin that looks like this? By the time we finish today's video, you'll be able to recognize scalp psoriasis and or seborrheic dermatitis. You're also going to learn some of the main things that dermatologists use to improve this condition. When you look at the scalp, you'll notice lots of redness, lots of inflammation. It's very typical of scalp psoriasis. In particular, let's look at the scalp before we even get into the hair-bearing area. Like, for example, on the frontal hairline, in the front hairline, you'll notice there's a significant amount of dryness and scale and redness. The scale is so thick you could even peel it off the surface, it seems like. You'll notice later in this video that the front hairline is so distinct that it will deserve its own treatment plan, separate and apart from the rest of the scalp in general. Let's also look at the scalp in general, moving from the front all the way to the back of the scalp. The thing that you notice the most is that the redness kind of permeates the entire scalp surface area, and this redness is found on this patient who has relatively light brown skin. If this patient had very dark brown skin, you might not see any of the redness at all. You may observe something like a dark gray color, or maybe even very rich hyperpigmentation. It's probably worth pointing out at this point that a lot of the dermatology clinical education that's available online and that's found in academic textbooks don't take into account the way that skin disease presents when it shows up in a darker skinned patient. There are certain things that you'll find on the surface of seborrheic dermatitis also. You'll find some scale production and redness as well. And there are diagnostic tests that are very helpful with seborrheic dermatitis. The diagnostic tests that stand out the most would be food sensitivity testing, environmental allergy testing. Also, biopsy analysis could be very important. The biopsy analysis, probably the best because it helps to make a definitive diagnosis. And you may even detect some yeast forms that are found in the biopsy specimen itself. The main things that are done while still in the office might include therapeutic injections, both on the frontal hairline and throughout the scalp. These therapeutic injections with Kenalog can help to speed up the recovery of this case. There's also things that we will obviously do at home to help the patient, and that will include things like on the frontal hairline, hydrocortisone 2.5% and ketoconazole cream used twice daily. For the scalp in general, we'll use fluocinamide 0.05% solution, massage into the scalp twice daily. Ketoconazole 2%, in which you will lather and rinse the scalp after 5 minutes of contact and lather. Hydrocortisone, I mentioned earlier, would be used on the hairline, but on the scalp, you would also use loratadine, an antihistamine by mouth twice daily. This inflammation is severe enough that you would also use prednisone 5 milligrams. You could use that once per week, unless the patient has a risk for diabetes, in which case you would hold the prednisone use or limit its use to a one-time dose only. I'm Dr. David Bryant. I'm the proud owner of World's Famous Dermatologist, a dermatology practice in Stockbridge and Decatur, Georgia. We help patients from all races and ethnic groups, but we're probably best known for our expertise in Black skin. The dermatologist that you go to and trust does not need to be a Black American like myself to be qualified to work on Black skin, but whoever you're trusting with these kind of conditions should have experience with a large volume of Black patients and be very experienced with skin conditions that affect darker skin types. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel. Please leave your comments below. I will consider your comments and questions the next time we cover similar content. I look forward to connecting with you on the next video.